Morning, everyone. Welcome to the Parliamentary Precinct in downtown Ottawa. I'm Chris Rans, the moderator with Parliamentary Press Gallery Executive. We have with us 4 people for our briefing today. Jean-Yves Duclos, who's just being seated there, the Federal Minister of Health. In Moncton, New Brunswick, we have the Honourable Dominic LeBlanc. He's the Minister of Intergovernmental Affairs. And virtually in Greater Ottawa, we have the Canada's Chief Public Health Officer, Dr. Theresa Tam, and Dr. Howard New, her deputy. This press conference will last about 60 minutes. If Minister Duclos would begin, please. Good to see you, sir.
Would be Minister LeBlanc first.
Merci beaucoup, Jean-Yves.
Thank you very much,
Good morning, everyone. Across the country, we're seeing an increase in daily COVID-19 cases. The new variant, once again, signals our need to be vigilant and continue to follow public health guidelines in order to reduce the spread of the virus. Comme nous l'avons fait depuis le début de la pandémie,
like we've been doing since the start of the pandemic, we are working in close collaboration
avec les premiers
with
ministres
the
de tout le
premiers
pays
from
pour nous
all over
adapter
Canada
à ces circonstances
to adapt
changeantes.
to the changing
The
situation.
Omicron variant is having a major impact on the day-to-day lives of Canadians, and I can assure all of you that our government will continue to use the resources we have to support provinces and territories as they deliver care in their communities to the extent possible. Mon collègue, le ministre Bill Blair,
My
est
colleague,
parfaitement
Minister
conscient
Bill Blair,
des
is
difficultés
perfectly
auxquelles les
aware of the
provinces
challenges that are
et les
being faced
territoires
by the
sont
provinces and
actuellement
territories.
confrontés. Les hôpitaux, les travailleurs de la santé et les
Hospitals,
collectivités
healthcare workers, and
subissent une
communities
pression
are
croissante
facing
que les
increasing
gouvernements
pressure.
provinciaux et territoriaux
Provincial
tentent de
and
gérer
territorial governments are
alors
trying to
qu'ils
manage this
intensifient
situation
les
while
campagnes de
challenges are
vaccination et
intensifying
de
at the
dépistage.
same pace as
Le gouvernement
vaccination and
fédéral
testing campaigns. The
continuera
federal
de
government
fournir
will
des
continue
millions de
to
vaccins
provide
et un
millions of
nombre
vaccines
record
and a
de
record
tests
number
de
of
dépistage.
testing.
We anticipate increasing requests for assistance from provinces and territories in the coming weeks. While we will do everything we can to respond, it's important to remember that healthcare ultimately is a provincial and territorial jurisdiction, and we as a government have to efficiently use the federal resources we can bring to bear to fill the gaps that provinces and territories are identifying. Nous allons continuer à
We
travailler
will
avec nos
continue to
partenaires
work
pour
with our
répondre à ces
partners in
besoins
order to respond
avec
to
les
the
outils
needs
dont nous
with the
disposons
tools that
en
we
tant
have at
que
our
gouvernement
disposal
fédéral
as the federal
et faire
government.
tout ce qui est possible pour
We will
protéger
do everything
les
possible
Canadiens.
to protect
As
Canadians.
we regularly do, we will be speaking with all of Canada's premiers early next week to discuss the changing realities we are seeing and how we can continue to work collaboratively to keep Canadians safe. At a time when our healthcare system is under stress, Mr. O'Toole is encouraging people to do things that are adding to that pressure and that will continue to put Canadians and our healthcare workers at increased risk. Almost 2 years into this pandemic, it's hard to believe that Mr. O'Toole still doesn't get it. Vaccines work, and vaccines are the best way out of this pandemic. That's why we put in place mandatory vaccine requirements for federally regulated workplaces and for people wanting to travel by airplane or train. But Mr. O'Toole won't support these requirements, and he won't even ensure that his own members of parliament and senators are vaccinated. His lack of leadership would only force more lockdowns and put Canadians at greater risk. Ce qui semble inquiéter Monsieur O'Toole
What seems
le
to
plus,
concern Mr.
c'est
O'Toole
son
the
avenir
most
comme
is his
chef du
own
Parti
future
conservateur.
at the helm
C'est
of
de
the
plaire aux
Conservative
membres
Party.
de son parti
He is seeking to
plutôt que de
please the members
soutenir
of his party
nos travailleurs
rather than
de
to
la santé.
support
En
the
plus,
healthcare
il
workers.
s'est opposé au
Furthermore,
soutien pour les
he
gens
was
qui font la bonne
against
chose
supporting
pour que les
people who are doing the
travailleurs
right
puissent
thing
garder leurs emplois
which would protect
avec notre
workers' jobs
subvention
with
salariale.
our
Mr.
salary
O'Toole seems
supplements.
once again more focused on his own job and appeasing members of his own party than supporting Canada's healthcare workers. On top of that, he opposed supports for people who are doing the right thing, like keeping their workers connected to their jobs through the federal wage subsidy. Our priority has been and will always continue to be working collaboratively to keep Canadians safe. Avec ça, je vous remercie beaucoup
With
et je
that, I
donne
thank you very
la
much,
parole
and
à
I would
mon
like to give
collègue
the floor to my
Jean-Yves
colleague, Jean-Yves Duclos.
Merci beaucoup, Dominic,
Thank
et
you very much,
bonjour à vous
Dominic,
toutes
and hello
et vous
to
tous.
everyone
Et
who's
merci de
tuning
vous
in.
joindre à nous aujourd'hui.
Thank you
La
for being here
Dr. Tam
today.
et le Dr.
Dr.
New se
Tam and
joignent
Dr.
aussi
New
à
are
nous
joining us
virtuellement.
also virtually.
We want to talk today about how the government of Canada is working with the provinces and territories to ensure that Canada has the tools it needs to cut the spread of the Omicron variant. On Wednesday, the Prime Minister and I announced that the Government of Canada will deliver an additional 140 million rapid antigen tests to provinces and territories this month. Mercredi,
On Wednesday, the Prime Minister and I announced that the Government of Canada would deliver an additional 140 million rapid antigen tests to provinces and territories this month. These tests will be delivered to provinces and territories on a per capita basis and are already beginning to be delivered.
These tests, which will be delivered to provinces and territories on a per capita basis, are already beginning to be delivered. Rapid antigen tests are an important tool to empower individual Canadians to cut the spread of the Omicron variant. These tests enable Canadians to validate their symptoms and take personal action to isolate and reduce the risk to others. Rapid tests remain a first vital line of defense in helping to identify and therefore to reduce the spread throughout the country. Les tests antigéniques
Rapid
rapides
antigen
sont un
tests
outil
are an
important
important tool
pour nous
to
permettre,
empower
comme
individual
citoyens, de
Canadians
freiner la
to
propagation
curb the
du
spread
variant
of the
Omicron.
Omicron variant.
Ces tests
These
permettent aux
tests enable
Canadiennes et aux
Canadians to
Canadiens
validate their
de
symptoms
valider leurs
and take
symptômes
personal
et de
action
prendre des
to
mesures
isolate and
individuelles
reduce the
pour
risk
s'isoler et réduire le
for
risque pour
others.
les autres. Les tests rapides
Rapid tests
demeurent une
remain a
défense de
vital
première
first
ligne
line of defense in
essentielle
helping
pour
to
cerner et donc
identify new
réduire
spread
de
and
nouvelles
reduce
transmissions dans
spread
l'ensemble du pays.
throughout the country.
Yesterday, I met with my colleagues from provinces and territories, health ministers, to discuss what collectively we are doing to shore up our defenses against Omicron. I want to thank all of my colleagues from all provinces and territories for our conversations yesterday, and more importantly, for our and their continuing hard work and difficult decisions during this crisis, and for their unwavering commitment to the health of all Canadians. Together, we will continue to protect Canadians and manage through the challenges of this new Omicron variant. For the federal government, that includes securing access to leading-edge drugs and treatments, including antiviral treatments. As you know, we have already signed and secured agreements with both Merck and Pfizer to supply Canada with oral antiviral drugs. I will have more to say about those drugs and about Health Canada's approval process in the coming weeks. Hier, j'ai rencontré mes homologues des différentes provinces et des différents territoires pour discuter de nos efforts collectifs pour renforcer nos défenses contre le variant Omicron. Je tiens à remercier les ministres de la Santé des provinces et des territoires pour notre discussion d'hier, mais encore plus important, pour leur travail acharné et difficile pendant cette crise, pour que tous ensemble, nous puissions protéger la santé des Canadiens de toutes et de tous à travers le pays. Ensemble, nous continuerons de travailler à protéger notre population et réduire et traiter des défis que présente ce nouveau variant Omicron. Cela
Omicron.
inclut pour le gouvernement canadien de
For the federal
garantir
government, that
l'accès à des
includes
médicaments
securing
et à des
access to
traitements
leading-edge
de pointe,
drugs
y
and
compris ce qu'on
treatments,
appelle les traitements
including what are
antiviraux.
called antiviral
Comme vous le
treatments.
savez, nous avons déjà
As you know,
conclu et
we
annoncé
have
des
already
ententes en
signed
décembre
agreements
avec
with
Merck et
and
Pfizer
Pfizer,
pour
and this happened in
l'approvisionnement au
December.
Canada
These companies will supply
matière
Canada
d'antiviraux oraux.
with oral
J'en aurai plus
antiviral
à dire
drugs. I
prochainement
will
au
have
sujet
more
de
to say
l'évaluation de ces
about
traitements et
Health
au sujet
Canada's
de leur
assessment of these
usage pour
treatments
protéger
and how
les
they will be
Canadiens et
used
les
to protect
Canadiennes.
Canadians.
More broadly, getting vaccinated, wearing a mask, and taking personal health precautions continue to be the best way to stop the spread of COVID-19 in our communities. Every Canadian, every one of us, has a role to play, and the vast majority of us have stepped up to do our part. To date, 77% of all Canadians of all ages have been fully vaccinated. Right now, provinces and territories are rapidly rolling out booster campaigns, and more than 8.6 million booster shots have already been administered across the country. I'm also pleased to report that there will be enough doses of the vaccine to give all kids aged 5 to 11 2 doses by the end of this month. If you haven't already done so, I encourage you to roll up your sleeves and get that first, second, or third shot. As the Prime Minister said just Wednesday, it is never too late to do the right thing. I personally got my booster shot just yesterday, and I'm happy to say it was Moderna. Indeed, both Moderna and Pfizer are solid, efficient, and safe mRNA vaccines. Je me permets de le répéter.
I allow myself to repeat
prenons et
it.
prenez
Please
le premier vaccin disponible.
take the first vaccine
Please
that's
take the
available.
first vaccine accessible to you. Nous avons à la fois les outils et la
We
volonté
have both the
nécessaires pour
tools
travailler, pour
and the
traverser cette
will
nouvelle
to
vague.
navigate this
Mais nous
pandemic
avons besoin
safely.
de vous,
But we need
nous avons
you.
besoin de nous tous et de nous
We
toutes.
need all of you
La
and all
vaccination,
of
le
us.
port du masque,
Getting
les mesures
vaccinated,
sanitaires
wearing a
individuelles
mask, and
restent les
taking
meilleurs
personal
moyens
health
pour arrêter la
precautions
propagation de la
continue to be the
COVID-19
best
dans
ways
nos
to stop
collectivités.
the spread of
Chacun
COVID-19 in our
d'entre nous
communities.
a un rôle à jouer
Each and
et la
every one
grande
of us has a
majorité
role to
d'entre nous
play,
a
and the
aussi
vast
fourni sa
majority
part
of us
d'efforts.
has already
À
done
ce
their
jour,
part.
en effet, plus de
To date,
77%
indeed,
de la population
77%
canadienne de
of
tous les
eligible
âges a
Canadians
été
of all
entièrement
ages have been
vaccinée.
fully vaccinated.
À l'heure actuelle, les provinces et les
Right
territoires
now,
accélèrent
provinces and territories
considérablement leur
are
campagne d'administration
accelerating
de doses de
their
rappel et
booster
plus de
campaigns, and
8,6
more than
millions de doses de
8.6
rappel
million
ont
booster
déjà
shots have
été
already been
administrées à travers le
administered
pays.
across the country.
J'ai également le plaisir
I'm also
d'annoncer
pleased
qu'il
to
y aura
report that there
suffisamment
will
de
be
doses
enough
de vaccins
doses
pédiatriques,
of
c'est-à-dire des
the
doses de vaccins pour les
pediatric
enfants de 5
vaccine,
à 11 ans,
so for
au
children
cours
5
de
to
ce mois de
7,
janvier, pour que chacun de ces enfants puisse être
to
vacciné
vaccinate
doublement.
each child with
Si
2
vous ne l'avez
doses.
pas encore fait, je vous
If you
encourage à
haven't already
relever
done
votre
so,
manche
I
et à
encourage
recevoir
you to
votre
roll up your
première,
own sleeve
votre
to get your
deuxième
first,
ou votre troisième
second, or
dose.
third shot.
Comme l'a dit le Premier ministre
As the
Trudeau
Prime
plus tôt cette
Minister
semaine,
said earlier
il
this
n'est
week,
jamais trop tard
it is
pour
never
bien
too
faire.
late to do the right thing.
This is obviously a difficult and uncertain time. What we choose to do now will determine our very short-term future. The Government of Canada will be there and is there to support you in your communities and you, colleagues in provinces and territories, as we work together to finish this fight against COVID-19. Nous avons tous un
We all
rôle à
have a
jouer
role to
comme
play
citoyens pour en
as
finir avec ce
citizens
virus
to beat
et nous
this
devons
virus.
tous jouer ce rôle.
And we all must do our
Continuons
part.
à faire preuve de
Let's
prudence,
continue to be
continuons à
prudent,
prendre soin les uns des
continue
autres.
to take care of one
We know
another.
what we need to do, and we have the tools to do it, so let's continue to exercise prudence and caution and take care of each other. Je vais maintenant me tourner
I
vers
will
la
now
Dr.
give
Tam.
the floor to Dr. Tam.
Merci, Minister Duclos, and bonjour
Thank you, Minister
à toutes et à
Duclos,
tous.
and hello to everyone.
Since the last epidemiology update prior to the holidays, COVID-19 cases have continued to accelerate rapidly, with Omicron now predominating and widespread across much of the country. Nationally, the average daily case count has increased by 65% compared to the previous week, with an average of close to 42,000 cases being reported daily over the last 7 days up to January the 5th. Although very high infection rates have challenged testing capacities in many areas of the country, which will underestimate true case numbers, we continue to test and sequence at very high levels to track the spread of the virus as well as monitor variant predominance. At the same time, we're using multiple other indicators such as laboratory test positivity and hospitalization trends that continue to be very useful for monitoring overall disease activity and severity, respectively. Currently, these trends are all increasing as a result of the sheer number of cases occurring with this rapidly spreading variant. For the most recent 7-day period, laboratory testing positivity is estimated at 29%, indicating significant community transmission. Although evidence from ongoing surveillance and recent studies indicates that this risk of hospitalization is lower for Omicron compared to Delta, the sudden acceleration of Omicron and enormous volume of cases is driving severe illness trends. Given current daily case counts are already about 400% higher than the peak of the third wave, it is not unexpected to see daily hospitalizations rising. However, international surveillance suggests that while these trends can be expected to increase with the Omicron surge, severe illnesses are not rising at the same explosive rate as for cases. Presently in Canada, over the past week, an average of close to 3,650 people with COVID-19 were being treated in their hospitals each day, with almost 600 in intensive care units, representing weekly increases of 91% and 25% respectively. During the same period, there were on average 39 deaths reported each day. Currently, we still need millions more Canadians to increase their protection with COVID-19 vaccines, including almost 7 million eligible people who need a first or second dose of their primary series. As well, many others are eligible to get a booster dose to help restore protection that may have waned since their second dose. Moreover, there is accumulating evidence that a booster dose results in better protection against severe illness, including against the Omicron variant that appears to have a higher degree of immune evasion. Booster doses are particularly important for certain groups, such as healthcare workers and those at highest risk of severe illness from COVID-19, including older adults, people with high-risk medical conditions, and people in and from Indigenous communities. Either Pfizer-BioNTech or Moderna mRNA vaccines are effective as boosters, so please feel confident in accepting whichever vaccine is offered to you. As public health authorities continue with vaccination efforts, while closely monitoring local epidemiology for signs of peaking activity in the weeks to come, we can all help by reducing our contacts to get us through this difficult time that much faster. Practically speaking, we need to continue to get fully vaccinated and receive a booster dose when eligible, limit in-person contacts to immediate household members as much as possible, and consistently use layers of personal protection to reduce the risk of exposure and spreading the virus, including wearing a good quality and snug-fitting face mask, maintaining good ventilation, and following local public health advice. This might feel like a double marathon that we didn't sign up for, but despite feeling tired, we should have a sense of achievement for the ground we've covered so far, for staying on track and knowing we can still draw strength from each other to get where we need to go. Thank you. Merci. Megwich.
Thank you, Doctor.
Bonjour à toutes et à tous.
Hello, everyone.
Depuis le dernier bilan épidémiologique qui a
Since
été
the last
dressé avant les
epidemiology
fêtes, la montée
update
des
prior
cas
to
de
the holidays,
COVID-19 a
COVID
connu une
cases have
accélération
continued
rapide.
to
Le variant
accelerate
Omicron
rapidly,
étant
with
désormais
Omicron now
prédominant et
predominant
répandu dans
and
une bonne partie
widespread
du
across
pays.
much of the country.
À l'échelle nationale, le
Nationally,
nombre
the
moyen de
average
cas
daily case
quotidiens
count
a
has
augmenté
increased
de
by
65%
65%
par rapport
compared to
à
the
la semaine
previous week,
précédente et près
with
de
an
42
average
000
of
cas
close to
ont été signalés
42,000 cases
quotidiennement
being
en
reported
moyenne
daily
au
over
cours
the
des 7
latest
derniers
7 days
jours jusqu'au
up to
5
January
janvier.
5th.
Bien que les taux d'infection
Although
très
very
élevés
high
aient
infection
posé des
rates have
problèmes de
challenged
capacité
testing
de
capacity in
dépistage
many
dans
areas of the
plusieurs régions
country,
du pays, ce qui sous-estime le nombre réel des cas.
Which will underestimate the true case numbers. We continue to test and sequence at a very high level to track the spread of the virus, as well as monitor variant predominance. At the same time, we are using multiple other indicators, such as lab test positivity and hospitalization trends. They continue to be useful for monitoring overall disease activity and severity, respectively. Currently, these trends are all increasing as a result of the sheer number of cases occurring with the rapidly spreading variant. For the most recent 7-day period, lab test positivity is estimated at 29%, indicating significant community transmission. Although evidence from ongoing surveillance and recent studies indicate that the risk of hospitalization is lower for Omicron compared to Delta, the sudden acceleration of Omicron and enormous volume of cases is driving severe illness trends. Given current daily case counts are already about 400% higher than the peak of the third wave, it is not unexpected to see daily hospitalizations rising. However, international surveillance suggests that while these trends can be expected to increase with the Omicron surge, severe illnesses are not rising at the same explosive rate as cases. Presently in Canada, over the last week, an average of close to 3,600 people with COVID-19 were being treated in our hospital each day, with almost 600 people in. This represents a weekly increase of 91%. During the same period, there were on average 39 deaths reported each day. Currently, we still need millions of Canadians to increase their protection with COVID-19 vaccines, including the almost 7 million eligible people who need a first or second dose of their primary series. As well, many other eligible people are eligible to get a booster dose to help restore protection that may have waned since their second dose. Moreover, there is accumulating evidence that a booster dose results in better protection against severe illness, including against the Omicron variant that appears to have a higher degree of immune evasion. Booster doses of the Pfizer and Moderna mRNA vaccines are particularly important for certain groups, such as healthcare workers and those at highest risk of severe illness from COVID-19. This includes older adults, people with high-risk medical conditions, and people in and from Indigenous communities. mRNA vaccines, whether Pfizer or Moderna, are effective booster doses, so trust them and accept the vaccine that is offered to you. As public health authorities continue with vaccination efforts, while closely monitoring local epidemiology for signs of peaking activity in the weeks to come, we can all help by reducing our contacts to get us through this difficult time that much faster. Practically speaking, we need to continue to get fully vaccinated and receive booster doses when eligible. Limit in-person contacts to immediate household members as much as possible. Consistently use layers of personal protection to reduce the risk of exposure and spreading the virus. This includes wearing a good quality and snug-fitting face mask while maintaining good ventilation and following local public health advice. This may feel like a double marathon that we didn't sign up for. But despite feeling tired, we should have a sense of achievement for the ground we've covered so far, for staying on track, and knowing that we can still draw strength from each other to get where we need to go. Thank you. Merci, Miigwech.
Thank you, Dr. New. We have 36 minutes for questions and answers. We'll be going to the phones for the first section, and with one question, one follow-up. The final 10 minutes will be for the reporters in the room. Operator, would you please begin, please? And a reminder, if the questioners and the people answering could keep everything succinct so we can get through more people. Please go ahead, Operator.
Thank you, merci. You may press star 1 if you have a question. Vous pouvez appuyer sur étoile 1 si vous avez une question. La première question est de Boris Proulx, Le Devoir. La parole
Boris Proulx, Le Devoir.
Bonjour. Au sujet des tests rapides.
About rapid
au
testing.
Québec, votre annonce pour
In
les
Quebec,
nouvelles livraisons du mois de janvier est considérée comme une bonne nouvelle.
deliveries of new tests in January considered a good news. But there's no prediction for February, March, and following.
Les livraisons vont être en nombre égal.
Do you know if deliveries will be the same amount or higher in the months after? Answer. Thank you, Mr. Proulx and Mr. Boris, for the question.
Le souhait, et je l'ai entendu à nouveau hier lors de ma conférence avec les ministres de la Santé des différentes provinces et des territoires, le souhait d'avoir plus de prévisibilité.
Of having a better predictability with materials. We also wish this.
Qui sont considérables, mais qui sont dans un environnement mondial où les chaînes d'approvisionnement sont particulièrement fragiles. Alors, on travaille plutôt bien par rapport à d'autres pays en termes de succès. De faire venir beaucoup de tests
so we're trying to bring as many tests as possible, as quickly as possible.
Le souhait de tous mes collègues à travers le pays d'avoir plus de
my colleagues throughout the country are looking for more predictability. I've spoken with my staff, and I'm working with the Minister of Procurement to see what we can do on that front. We need short-term predictability and also long-term predictability. Yesterday, we started a discussion that will continue in the next days and weeks regarding the distribution strategy for rapid tests. We have three main objectives. The first is, of course, to use these tests to meet our obvious public health objectives. The second is to be efficient. We want these deliveries to be quick and predictable, and that they serve public health objectives that are, of course, connected to our economic targets, to maintain our economy. And the third objective is to be equitable. We want to make sure that these tests are delivered to those people who need them the most, knowing that we'll also always have a scarcity of these tests in short and medium term. I'd also say that I'd like that I have more specific numbers. We're getting 31.5 million tests in Quebec for January out of the 140 millions. In Ontario, it's 54 million. Alberta, 16.2 million tests, and the other provinces will receive tests according to their population.
Merci. En introduction, vous avez dit que les tests rapides sont
in the introduction, you said that
la vice-première ministre, Mme Freeland, a dit qu'il y avait assez de tests
rapid tests were essential. Before the holidays, Minister Freeland said that we had enough for everyone. So do you have an answer to explain why people in your own riding aren't able to get their hands on a rapid test? Answer. Well, before December, we respectfully found that there was very little demand for rapid tests throughout the country. This isn't pointing the finger at anybody, it's just a statement of fact. Things changed in early December with the arrival of the holidays. We knew that people were going to see more people, so provinces and territories advised us that there was a higher demand for rapid tests. In December, we received 5 times more requests for rapid tests that we'd had in the previous months. So we were able to deliver many more tests than the months prior. But with the Omicron variant, we found that even with this increased demand from the provinces, stocks were insufficient to respond to demand. So in January, we will deliver 140 million tests, which is 4 times more than what was delivered in December, which was 5 times more than what was delivered in the months prior. We're working very quickly, especially considering that worldwide supply chains are very fragile with rapid tests. We work daily with our suppliers to make sure that we have the amounts of tests delivered per the deadline.
Operator, next question,
Thank
please.
you. Thank you. Merci. The next question is from Ryan Tumulty from the National Post. Please go ahead.
Yeah, hi. My first question is for Minister Duclos. Dr. Tam, before the Christmas break, released her annual report calling it a vision to transform Canada's public health system. Calls for a lot of changes, more data, more workers, that sort of thing. I'm wondering if you support this vision, if your government's going to be acting on it.
Yes, three important items, as you mentioned: data, workers, human resources, and technology. We had a conversation on that with my colleagues, health ministers, yesterday. These are going to be key, not only in going through the current Omicron crisis, but also in terms of emerging from that crisis and rebuilding our healthcare system. We need a lot more data for all sorts of reasons. We need more workers. Health workers are tired, exhausted. They have left in large numbers. In the current circumstance, they are sick in very large numbers as well. And we need to be making better use of technology, some of which we have developed in the COVID-19 crisis, but some of it we have to develop as quickly as possible, as I said, both to exit and to rebuild from the crisis.
Supplementary, Ryan?
Yeah, this one's from Minister LeBlanc. You mentioned off the top of the presser that the federal government's resources are limited, that health is a provincial jurisdiction. Are you telegraphing, I guess, to provinces that in terms of their requests for emergency help, like you received from the Bearskin Lake First Nation today, and I'm sure you'll receive from other provinces as the week goes on, that there is a limit to what the federal government can provide and that maybe you are hitting that limit?
I think what we've said two things from the beginning of the pandemic, that obviously the government of Canada will do whatever we can, as often as we can, to support provinces and territories and Indigenous communities. So that shouldn't surprise anyone. And I think over the last 22 months, we have worked very collaboratively with provinces and territories and Indigenous leadership to certainly, in an unprecedented way, use the resources of the government of Canada, wherever and however we could bring them to bear, in a way to support provinces and territories. We expect, as you noted, an increase in the coming weeks in terms of requests for assistance. My colleague Jean-Yves Duclos, Patty Haidu, Bill Blair, obviously, we're in ongoing and active conversations with provincial counterparts, and they're saying to us that we're preparing perhaps a request for assistance in this particular area, or we're wondering if the government of Canada might support a provincial or Indigenous community in another area. So we're moving expeditiously to do obviously everything we can. But it's no surprise that provincial and territorial governments have considerably more health human resources, for example, than would the government of Canada. And that's why we need to be expeditious and effective in allocating all the federal resources we can in a way that most efficiently fills the gaps that provinces and territories identify. So it's an ongoing, collaborative, and we think positive exercise. But it shouldn't surprise anybody that it's not a limitless number of federal health care resources that we can bring to bear. So our job is to take absolutely everything we can and allocate it in the most effective way to support all of our partners and Canadians to come through the other side, particularly of this urgency around the Omicron variant.
Operator, next question, please.
The next question is from Christy Kirkup from the Globe and Mail. Please go ahead.
Hello. Provinces are imposing restrictions or lockdown measures due to healthcare capacity. And of course, we've seen this a lot in Canada. And I'm wondering if this shows that from coast to coast, the capacity of Canada's primary healthcare system is stretched too thin. And how is the federal government going to address this?
Well, thank you. And I agree with your statement. The capacity is stretched too thin, certainly in the current emergency context. But more broadly, I think most Canadians would agree that even before COVID-19, our capacity was often stretched too thin, in particular around this time of the year when there were other respiratory diseases and other challenges around the particular season. Now, what we're doing, well, what we've done during with COVID-19 was to invest, just in terms of healthcare, a total of $63 billion, in addition to all of the other transfers that were already in existence before COVID-19. We obviously provided a lot of support, economic support. More than 80% of the total direct assistance to workers and businesses came from the federal government. And what we have announced in the campaign was an additional $25 billion to be invested in the relatively short term to address all sorts of issues around health and healthcare, but in particular, the healthcare resources issue, which is a tremendous problem across all the country. If I may add briefly to what Minister LeBlanc said a moment ago, we often think of the Canadian Armed Forces as being a potential source of important healthcare support. They have a population of about 70,000 personnel to serve. Now, 70,000 is about 8 times less than my own city of Quebec. Quebec City has 8 times more people than that 70,000 personnel that healthcare workers in the armed forces need to be looked after. So that says that we have a very limited amount of healthcare resources, health-trained people in the CAF, and that's why we have to answer in the most appropriate, the most focused, and the most equitable manner when requests are made by provinces for healthcare personnel support. What we can do, and what Minister LeBlanc also mentioned, is to provide vaccines, tests, personal protective equipment. We can provide tracing support. We can provide all sorts of other non-human resources types of assistance. This we have done, I think, quite successfully, and will continue to do in the short and the longer term, as we do our best with the Canadian Red Cross and other partners to also provide, in some specific context, support on health-related human resources.
Supplementary, Christy?
And yes, thank you. And just as a follow-up, if I may, the other day when you announced the 140 million rapid tests that will be going out to the provinces and territories on a per capita basis, I'm wondering, I fully understand that you have said that the distribution falls into the realm of the provincial and territorial governments. But I'm wondering, do you have any concerns about the equity of access? We've seen, for example, in the province of Ontario, people lining up in minus 20 degrees Celsius for hours on end trying to get access to rapid tests. And I'm just wondering, do you have any concerns about this? And frankly, not a lot of Canadians have the time to line up in frigid, cold temperatures to try and get access to a test that can maybe tell them if they have COVID-19.
Thank you. Well, on the equity and the efficiency of the distribution, we have full confidence that provinces and territories will do what they need to do to address the needs of their population. The Prime Minister on Wednesday mentioned that again. They have access to more information and to more networks to distribute those tests in the most fair and efficient manner. One equity issue which I would add, which you didn't mention in your question, was the equity of the distribution of rapid tests across provinces and territories. The reason we're moving to a per capita formula is that prior to January, there were provinces and territories that didn't ask as many rapid tests as they could have asked based on their per capita share of the population. So with a per capita formula, we're going to make sure that every province and every territory, and therefore every person in Canada, wherever that person may live, has access to the same amount of rapid tests, and that again is going to be done by the per capita formula.
Thank you, operator. Next question, please.
La prochaine question de Mylène Crête, La Presse.
Mylène Crête from La Presse.
Bonjour, j'ai une question concernant le réactif qui est utilisé pour
I have a question using the reactive agents used for PCR testing.
Vous anticipez une pénurie
Do you anticipate a shortage of this
On sait que
agent?
le réactif est en très grande demande.
We know that the reactive
Nous n'avons
agent
pas, et je
is
me
in
tournais
high demand.
vers le docteur New dans quelques
And I'll ask
secondes. Nous
Dr.
n'avons
New
pas
to
présentement
respond further in a few
d'indication de la
moments,
part des
but
provinces et
currently there is
territoires
no
qu'il
indication
y
from the
a
provinces
une
and territories that
pénurie et
there
donc
is
une
a shortage.
demande de réactifs de la part du
So
gouvernement
a
canadien.
request
S'il y avait de
for
telles demandes, le gouvernement
reactives
canadien
from the
continuerait à faire ce
government,
qu'il
federal
doit faire,
government.
c'est-à-dire de répondre
Should
à
there
ces
be a
demandes de
demand,
manière la plus rapide
the
et la
federal
plus solide
government
possible.
will
Et pour être sûr
react as quickly as
d'avoir les
possible and as
informations vraiment
effectively
à
as
jour,
possible.
j'inviterai
But
le
in order to
docteur
have
New à
up-to-date
préciser ce que je viens de
information, I
dire.
would like Dr. New to respond.
OK, bon, merci pour la question.
Thank you for the question.
Notre laboratoire national de
I can tell you
microbiologie à
that the
Winnipeg
National
travaille étroitement
Microbiology
avec leurs
Laboratory in
homologues
Winnipeg
des
has worked
provinces et
closely
territoires.
with
C'est
its
toujours
colleagues at
une
the
discussion
provinces
et
and
on est au
territories.
courant
This
avec
is
la
an open discussion. We are aware of the situation that exists in provinces and territories.
Comme avant, le laboratoire national est toujours
Just
prêt à
like
supporter
before,
comme
the
nécessaire
National
au fur et à mesure.
Laboratory is ready to support
un enjeu
as needed.
actuel. Le laboratoire national est prêt à supporter
If there's a challenge,
les provinces et
the lab
territoires
can
comme
support
nécessaire.
provinces and territories as needed.
Oui, j'aimerais savoir concernant les demandes d'assistance, combien
Regarding
de provinces
requests
de
for
territoires
assistance, how
ont
many
fait
provinces
une
and
telle
territories
demande
have
ou
made
vous ont
such a request
indiqué qu'elles feraient
or
une
have
telle
indicated
demande
that they
au
will
gouvernement
make a
fédéral?
request to the federal government?
Tout d'abord, inviter le ministre
Answer.
LeBlanc à répondre de
I
manière
would
plus
like to
générale, puis
invite
ensuite je fournirai des
Minister
précisions
LeBlanc to
particulières.
answer more generally, and then I will give more
Merci,
specific
Jean-Yves.
information.
Comme je pense que
Answer.
le Premier ministre
Thank you,
et le
Jean-Yves.
ministre Blair a
I
dit
think
depuis
the Prime
longtemps,
Minister and Minister Blair
il y a,
has said for a
je crois,
long
au-delà
time
de
that there
154 ou
are
155
over
demandes
144
d'assistance formelle sous
or
les ententes entre le
155
gouvernement
formal
fédéral et les
requests
provinces
for
et les territoires
assistance
depuis le
between
début
the
de la pandémie.
provinces and
Évidemment,
territories
il
and
y a
the federal
différentes
government since the
circonstances, c'est
start
pas
of the
uniquement dans le
pandemic. Of
contexte de
course,
la
there
crise
are many
sanitaire que
different
nous avons vu,
circumstances. Some of them are not related to the
l'augmentation
health crisis.
dans ces demandes
Some
d'appui
are
ou
related
d'assistance.
to increased
C'est un
requests for
processus
support.
bien rodé entre
This is
les hauts fonctionnaires des gouvernements provinciaux et
a
territoriaux
good process
et le
between
Centre d'opération
the
national du
federal
gouvernement du
Government
Canada.
and
Il y a une
the provinces and
conversation
territories and the
continue
National Operations
entre les
Center.
gouvernements quant
There's
aux besoins
ongoing collaboration
potentiels
between
en termes
governments
d'appui, en termes
regarding
d'assistance.
need for
Parce qu'on ne veut
assistance.
pas on veut minimiser les surprises, si
We
vous
want
voulez,
to
et
avoid
être en mesure de
surprises, if you
répondre,
will,
comme Jean-Yves Duclos
and
a
be
bien
able
dit,
to
le
respond
plus
like Jean-Yves
efficacement
Duclos
possible
said.
et
We
le
would like
plus
to
vite
respond as
possible. Alors,
effectively and
nous
quickly as
attendons,
possible.
juste en prenant constat des circonstances
So just
d'Omicron
by
à travers le Canada, que les
stating
autorités
the circumstances of Omicron throughout Canada, we know that provinces and territories will request aid from the federal government.
Oui.
Our answer is always yes, in as much as it's
Mais qu'est-ce qui
possible.
est important pour nous et qu'est-ce qui
What's
fonctionne
important
bien,
for
c'est
us and what works
qu'il y a ces
well for us
conversations continues
is to
qui
have
nous
these
permettent
ongoing
d'être prêts
conversations
et
that allow
de
us to
préciser
be
la meilleure
ready
façon
and
d'appuyer
to
une
identify
autorité
the
provinciale
best way to
quand la
support
demande
a
est
provincial
acheminée.
authority when they make such a
Et dans le
request.
contexte plus spécifique
Answer.
du Québec, si vous
And
pouvez,
for
si vous me
Quebec, more
permettez d'ajouter
specifically,
quelque
if I
chose,
could add something.
tout d'abord, et c'est au sujet de la vaccination,
This is
évidemment.
about vaccination, of
De
course.
manière très générale, je
Very
devrais
generally
souligner que les
speaking,
provinces et les
I would like to
territoires
say that
ont
provinces and
considérablement
territories
accru
have
leur administration de vaccins au
increased
cours des
their
dernières semaines.
vaccine
En
administration
décembre,
in the last
on
few
vaccinait à peu
weeks.
près 1
In
million de
December,
personnes par
we were
semaine
vaccinating
au pays.
about
En
1
janvier,
million
au
people
début du mois de janvier, on était
per
à peu près à
week
2 millions par semaine, et
throughout
maintenant
the
on est à peu
country.
près à 3
In early
millions par semaine.
January,
3 millions
vaccination
par
rates were
semaine,
about
c'est
2
3 fois
million
plus
per
qu'en
week,
décembre.
and now
C'est pas tout à
we're
fait
looking
les
at
4
3
millions
million
de
vaccinations
doses de
per
vaccins par
week
semaine qu'on
compared.
administrait durant l'été, mais c'est pas tellement loin.
So
Donc, on
the
est en
rates
train
are
de
not
récupérer
as high
la
as
vitesse
they
de
were this
vaccination
summer,
qu'on avait durant
but we
l'été. Et
are
ça,
picking up
je
the
pense que tous les
pace
Canadiens,
on
certainement
vaccination.
tous les Québécois,
I think
sont
that
fiers
all
du travail qui
Canadians
est en train de
and
être
all
fait
Quebecers
par les
are
provinces
very
et territoires.
proud of the work that's being done by provinces and
Les
territories.
200 soldats
The 200 armed forces personnel that are being deployed to Quebec are there to accelerate vaccination efforts for booster shots. This is excellent news. I think they are working in 5 different places: Montreal, Laval, in the Centre des Congrès, the Olympic Stadium, at De Carey Square, in Laval at Sport Expert Place, and also in Ahuntsic on Montreal. So 5 different places in Montreal are welcoming armed forces to help us with vaccination efforts. 100 other people are on hand that can be added to this effort if needed. And one more thing that I'd like to say, because I was shocked when I heard it, when I heard Mr. O'Toole said, which was alluded to by my colleague, Mr. LeBlanc, Mr. O'Toole was criticizing Canadian leadership and provincial leadership. There's a minimum level of leadership that we are expecting from Mr. O'Toole, and that is to get all of his members vaccinated. Vaccination is the one thing that will get us out of this crisis and that will help us fight against the Omicron variant. We all have a part to pay, and federal elected officials have a role to play, and they also need to lead by example for all Canadians.
La prochaine question est de Olivier Ferron-Boissé, TVA Nouvelle. La parole est à vous.
Next question from TVA Nouvelle.
Bonjour, merci de prendre nos questions.
Yes, thank you for answering our questions.
Duclos, il y a plus de la moitié des hospitalisations au Québec qui sont liées à des personnes
More than half of hospitalizations in Quebec are for people who are not vaccinated.
50 ans et plus qui refusent le vaccin.
There are people that are age 50 and up that are refusing vaccination.
Il y a la déclaration de revenus qui s'en vient au fédéral.
Are we going to be adding other measures federally? Answer. This is very relevant. This is a question that will come up from the federal government, from the Quebec government. I know that the situation is very difficult there. I know it's also difficult in other provinces. But if I can make a quick aside, in the Omicron wave, Quebec is first. Second comes Ontario, but also other provinces will experience very difficult situations with regards to hospital capacities. And they will be challenged in their ability to provide intensive care services. Dr. Tam was alluding to this earlier. There are almost 6,000 people that are hospitalized. Many of them in Quebec. This is the perfect storm that we were talking about at the very start of December. The perfect storm of reduced healthcare workers combined with a considerable increase of people who need hospital care. The number of people infected by Omicron has increased significantly. So the situation is very difficult. I have complete confidence in each province and Quebec in particular to do what needs to be done. We have to emphasize vaccination. This is true for Mr. O'Toole and anyone else who still has doubts about the importance of having everyone vaccinated. Vaccination is what's going to get us out of this challenge. Not only in the short term, but in the long term. COVID-19 will continue to be among us. There will be more variants. Omicron will continue to be among us for a long time. The only way to get out of this and to get a normal life is to get vaccinated. We need a mass amount of people to get vaccinated. We need our children vaccinated. We need people to get booster doses. We need to protect ourselves and to protect our loved ones.
Question.
My question is mostly about compulsory vaccination, like they're doing in Italy, where people will be hit in the pocketbook if they don't get vaccinated. Answer. I will give you a personal point of view. It's personal and not necessarily relevant because this is a decision that will be made by the provinces. I personally think we will get there at some point. Mandatory vaccination.
Bon, il y aura toujours des exceptions.
There will always be exceptions, of course. People who have medical reasons to be exempt
raison de ne pas se faire vacciner.
will be allowed not to get vaccinated.
Avec ce qu'on voit arriver présentement, avec ce qu'on sentait voir arriver il y a déjà quelques semaines, avec ce qu'on voit dans le monde,
would come a few weeks ago, what we're seeing throughout the world, we know that COVID-19 will be with us
au minimum plusieurs mois, peut-être
for many more months to come, maybe even many years.
La fragilité de notre système de soins de
Given
santé au pays,
how fragile our
vieillissement de la
healthcare system
population,
is in
les coûts
Canada,
accrus
our
qu'il y a
aging
à prendre soin de
population,
tout le monde,
increasing
je crois
costs
que ce
associated
genre
with taking care with
de
everyone.
mesure
I think this type of
qui n'est
measure,
pas considérée présentement, et on comprend
which is
pourquoi,
not being considered
va faire
now,
partie
and we
des
understand
discours,
why,
des
but it will
réflexions
be
et peut-être
part
même des
of
actions
what people
des
think
provinces et
about
territoires à plus
in
long terme.
provinces and what they think they could put into their action
That's all
plans.
the time we have for people on the phones, reporters in the room. We're going to try and land this in 11 minutes, so we'll begin with Creason from CTV, please.
Minister Duclos, thank you for taking my question. Can you provide any more details on the help needed for Bearskin Lake First Nation? At least half of the community of 400 have COVID. The chief there is calling for military aid now for 14 days or longer if needed. Ontario has joined in on those calls for military aid. Is the federal government going to answer those calls, and can you provide any timeline on this?
Well, three things here. First, and when I say we, it includes my colleagues, Minister Aidu and Minister Miller, Minister Blair, Minister Mendicino. So all my colleagues are very mindful of the very difficult challenges that those communities are facing now. The second thing is that we have had some relative success, and I think most people will say that we have had significant success working with Indigenous communities over COVID-19 in delivering to them the types of support that they need to look after the members of their community. And the third thing is that Minister Aidu in particular is in contact every day with leaders of those communities so that they can be provided with the type of support that they need. And from my part, with the Public Health Agency of Canada, we are also working with Minister Aidu and her team and her department to make sure that they have all the resources, the vaccines, the tests, the PPE, the tracing support, the expert advice that Minister Aidu and her department need to look after Indigenous communities and to help them go through this renewed challenge.
Is that a no on military aid so far? No decision made on that?
I would direct you towards Minister Blair and Minister Aidu for more specific information on that.
Also, Minister Duclos.
We've got to go to Christian Noel to get through 4 people, please. So, Christian, please.
Bonjour, Monsieur Duclos.
Hello,
Christian
Mr.
Noel,
Duclos. Christian Noel
from
Radio-Canada.
Obligatoire.
Regarding
à quel moment
mandatory vaccination,
au moment où il faut y réfléchir, vous dites
when
ça
is
va
the
faire
point
partie des
that we
discussions
have to
bientôt
start
des
thinking
actions?
about it? You
À
said
quel moment
that
est-ce qu'on
soon
va
it
être
will be
rendu là?
something we'll consider.
Bon,
When will that
moi
moment come?
de
Answer.
me prononcer là-dessus.
I really can't speak to that. What I said earlier, and I would like to repeat it, is it's a personal opinion. When I speak to experts in the country and internationally, public health experts tell us what we're heading towards. If we want to bring Canada, our Canadians, back to a more normal life, when we see how much strain is on our healthcare system, we understand that we have to get out of this situation. The one way to get out of it is to get vaccinated. Rapid testing, masks, distancing, PCR tests, all of those are great measures. They are part of our toolkit, and they are important. But the way to get out of this crisis definitively is to get vaccinated. That's why I see it coming personally. Not now. I don't think we're there yet. But I think that discussions need to be had about mandatory vaccination because we need to get rid of COVID-19.
Vous avez dit tout à l'heure au niveau de l'approvisionnement en
You
tests
said
rapides, on fait mieux
earlier
que d'autres
about
pays,
rapid
par
testing
exemple.
that we're doing better than other
Mais on a
countries.
quand même des problèmes d'approvisionnement.
But
Donc,
we still have
j'aimerais ça
supply issues.
spécifiquement comprendre quels sont les
Specifically,
défis logistiques qu'on
what
a
are the logistical
présentement
challenges that
et
we're
à quel
facing?
point est-ce que ça vous empêche de dire combien on en aura en
And
février et
how
en
are
mars?
these preventing you from telling us how many tests we'll have in February and March? Answer. We're, of course, very focused on the present. Currently, quickly, how can we get the maximum number of tests in our provinces and territories? That's what we're focusing on now. At the same time, we have to start having discussions about a longer-term strategy. Of course, this will be according to provinces and territories' needs and desires.
I wanted to ask you about disparities in provincial distribution of rapid tests. Saskatchewan has gotten more than twice as many tests as Manitoba because they had asked for more. You're now shifting the demand to per capita. Minister Vandal says, to be fair, you should balance this out to make up for provinces that got less. So I'm wondering if you're going to revise the per capita formula or if Manitoba is going to stay shortchanged here.
Well, the revision is started to be in place on January the 1st. As of January the 1st, our allocation formula is now a per capita formula, so that we can make sure, as you've correctly and appropriately mentioned, that all provinces and territories, and therefore everyone in Canada, has access to the same number of tests, and that there are no equity issues in terms of interprovincial considerations.
Okay, so you're not going to make up for that then?
Well, we'll always be in conversations with provinces and territories, but as I said, we're focusing on the current needs, and the current needs will be addressed on a per capita allocation formula.
Laura Osmond, CP.
Thanks, Ministers. I wanted to pick up on where my colleagues Ryan and Christy left off on the sort of finite resources of the federal government. We've never seen all provinces be so stressed at the same time. We know these requests are coming. We know our resources are finite. So what is the plan when we simply run out of resources? Is it up to provinces to sort of model it out at that point? Or what can you do in the meantime to try to fill that gap?
You're right. The two things on that. First, you're correct. The stress is seen everywhere. Second, this being said, the stress is being seen a bit earlier in some provinces than others. And there are two consequences for that. The first one is that Ontario and Quebec in particular, that's where the greater stress is currently found. Those two provinces are going through a very difficult time. That, however, is a signal to other provinces and territories that they may be just a week, perhaps 2 weeks behind, but they see, and I've observed that just yesterday with my colleagues from other provinces, they see what's coming. So they know that public health measures that everyone understands now will need to be applied across Canada because it's the same variant across Canada. So although a province may be just a week or two behind another province in terms of a stress on healthcare resources, that's coming, and sometimes coming very quickly. So I'm thinking of provinces where the number of hospitalizations per capita might be slightly smaller now, but these provinces and territories must know and must act on the basis of what they see with other provinces like Quebec and Ontario.
But Minister, eventually the federal government's going to have all of the personnel out that they're able to offer, and the provinces are still going to be short. So what happens then? What is the plan?
Well, as Minister LeBlanc said a moment ago, we'll continue to support provinces and territories to all possible extent. We've been quite successful at doing this collaboratively over the last 22 months, and we'll continue to do that, knowing that there are some types of support that the federal government will find harder to provide because we don't have the capacity. And that's also a warning, a kind warning, but a clear warning to some provinces and territories that they need to act now, because if they don't act sufficiently, it's going to be difficult for the federal government to help after because we don't have the capacity to do so. Sorry, act how? Sorry? In what way should they act? Well, everyone is doing their job, and I'm saying that, again, based on my conversations with them yesterday, they are acting, and they are right to act. And public health measures are obviously key. Providing support to businesses and workers so that lockdowns can be applied while taking care of the ability for everyone to pay for food. So these types of things are important. Lockdowns in some contexts when we see that the pressure is going to be too strong for in particular, our healthcare workers.
Minister, I think we have just enough time for Creason's other question, and I'm being asked for you to repeat in English your view about mandatory vaccines at some point. I believe you may have said that in French, and I just ask you to ponder that for a second and take Creason's final question.
Yeah, well, I can do that, and I'll say two things. First, it's a view which is based on my personal understanding of what we see internationally and domestically, and in my conversations with my colleagues, health ministers, over the last few weeks. And second, it's a decision that will be made by provinces and territories at some point, whether they move forward or not, that's going to be their decision to make. But what we see now is that our healthcare system in Canada is fragile. Our people are tired. And the only way that we know to go through COVID-19, this variant and any future variant, is through vaccination. PPE, physical distancing, tests, rapid tests, PCR tests, these are all very important tools. But what will make us move through this crisis and end it is vaccination. And I see in my own province, 50% of hospitalizations now in Quebec are due to people not having been vaccinated. That's a burden on healthcare workers, a burden on society, which is very difficult to bear, and for many people difficult to understand. So that's why I'm signaling this as a conversation which I believe provinces and territories, in support with the federal government, will want to have over the next weeks and months.
Really appreciate that, and we'll end with Creason's final question there.
Minister Duclos, Erin O'Toole said the unvaccinated should be accommodated through measures like rapid testing. What do you think should happen in this regard?
Can you? I was just slightly distracted.
Yeah, no, that's okay. Erin O'Toole said the unvaccinated should be accommodated through measures like rapid testing. What do you think should happen in this regard?
Rapid tests are not going to end the crisis. Rapid tests are not going to solve COVID-19. The only thing that will solve COVID-19 is vaccination. And that's why, again, so many people, including myself, are disturbed by the fact that Mr. O'Toole is not even asking his own members of parliament to be vaccinated. That's I don't understand, and I think no health expert understands, and most Canadians don't understand. No. The only way to end this crisis is to be vaccinated. Other tools are important, but Mr. O'Toole should ask his members of parliament, his caucus members, to be vaccinated. That would be a sign of leadership on his part. And before we end, je sais qu'en français, au Québec en particulier,
I know that in French and in Quebec in particular, in the last few days, we've been shocked and concerned by the story of those travelers on that Sunwing flight. Like many people said, their behavior was irresponsible and inexcusable and unacceptable. In the last few hours, we've received updates on some of these travelers. They are hoping to come back to Canada. So starting as of Wednesday, 27 of the 130 passengers have arrived back in Canada. They took 4 different flights. They were met. They were met at those 4 airports. They were intercepted and interrogated at the air border. They were all tested on arrival. Respecting public health advice was enforced. We checked their vaccination status, their PCR test results, and their quarantine plans.
proactivement
the Sécurité du Québec contacted Public Health Agency of Canada to obtain contact information for these travelers to make sure that they are following their quarantine plans. Also, their files have been referred to the Government of Quebec for penal and criminal issues because this is provincial jurisdiction and they will have to follow up on these infractions. All of this is added to the investigation that will continue with regards to how they broke transport rules. There are public health rules, but there are also Transport Canada rules. If we see the images that were shared, Transport Canada rules were broken. So there you have it.
Because Sunwing has been such a cause célèbre across the country, if you could share your thoughts on that in English as well, because I think I heard some news there.
Okay, so I'll try to do that in my best English. And so first, we hear and we know that this issue of Sunwing travelers having behaved irresponsibly, inexcusably, and unacceptably on a flight to Mexico, that has raised a lot of anger and frustration, as the Prime Minister said just 2 days ago, on the part of many Canadians. Recent information that we were given indicates that about 27 out of these approximately 130 passengers have now returned to Canada on Wednesday. They were all stopped and interrogated at the air border. They were then all tested. They were checked with regards to whether they had obeyed and followed all of the health regulations that they were supposed to follow throughout their trip, in particular regarding their proof of vaccination, the quality, the integrity of their PCR test. Their quarantine plan were also inspected. And all of that was correlated with the information that they had entered into ArriveCan, which is an essential tool for all travelers entering Canada. La Sûreté du Québec, which is the provincial police department, proactively contacted the Public Health Agency of Canada to seek information on those travelers. The contravention files that were issued for some of these travelers were sent to the Government of Quebec through their legal authority and team, and that's in addition to the ongoing investigation and possible prosecution that Transport Canada and other agencies will continue to pursue.
Minister, I really appreciate your briefing today. Doctors, thank you. Thank you to Minister LeBlanc and Moncton. And this completes this news conference and briefing from the Parliamentary Precinct in downtown Ottawa.